Today on Accidental Experts with Bryce Hamilton.
Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited for our topic today. So we are going to be talking with Eli Lebowitz, and he is a doctor of psychology, and he is also the author of a book called Breaking Free of Childhood Anxiety and OCD, and also one of the developers and main developer of a program called the Space Treatment, which is a specialized program for kids with anxiety and OCD. So with that, we're going to get to Dr. Lebowitz.
Well, thanks for having me.
Yeah, so we're going to be talking about anxiety, OCD, and also this really cool program that you and your team came up with to help parents with kids who have anxiety.
Great.
So can you tell us about yourself and how you developed this program?
About myself, well, I'm a psychologist. I focus on child anxiety, OCD, related conditions. I co-direct the Anxiety and Mood Disorders program at the Yale Child Study Center. And I've been pretty focused on families, family systems, and the role of parents for a long time. Historically, parents were often seen as the target for treatment when you talk about other problems like externalizing problems, behavior problems, where engaging kids in treatment can be a real challenge. But in the context of anxiety problems, much less so. And so, the frontline treatment really for a long time has been either cognitive behavioral therapy, which requires a very high level of child engagement and motivation, collaboration, etc., and works really well for a lot of kids, but not for all kids. Or medications, which also require some collaboration on the child's side and are not every parent's favorite option. And so I was really motivated to think about, how we could do more for parents of anxious children, and that was part of what led me to really think about the role of parents. And we could talk a little bit more in detail about where that led.
Yeah. Well, it's great. I think I agree with you because in my practice, seeing kids with anxiety, oftentimes it was really focused on the kid and then teaching the parent the skills that the kid is supposed to practice and not necessarily giving the parent skills on how to help their kid, except for like psychoeducation of like, what is anxiety? But that kind of leads us to the next question I have for you. So what is anxiety and how would people know if their kid does have anxiety?
Well, what is anxiety? Anxiety can take a lot of forms. And I think it's important to remember that anxiety itself is not really a disease. We are kind of supposed to be anxious some of the time. It's a really important part of being a human being, really even across species. We all need an anxiety system to keep us safe. And so it's really a broad term that refers to all of the different changes that occur when we either detect a threat, physical threat, psychological threat, any kind of threat in the environment, or when we think that we might encounter such a threat, even in the future. And so it helps to keep us safe. But like any alarm system, it can be a little bit miscalibrated. And just think about car alarms. I'm guessing that everybody listening to this has heard car alarms probably multiple times in their life. But if they ask themselves, how many times have I heard a car alarm go off because a car was being stolen? Well, that might be a much smaller number of people. Most of the time when we hear that sound, a car isn't being stolen. It's just that something has triggered the alarm, right? That could be rain or a truck going by or just anything. And it's similar with our internal alarm systems. Sometimes it might go off because there's a real threat, but a lot of times it goes off because we're misinterpreting situations or because it really is just very, very sensitive. And that's when we start thinking about anxiety disorders. It's when that alarm is being triggered chronically, a lot of the time, we just feel anxious all the time and are very focused on threats. And that can really get in the way of just healthy, normal functioning. And so we would say a child, or an adult for that matter, has an anxiety disorder when their internal alarm system, when their anxiety is really acting up too much of the time and is getting in the way of just normal function, whether that's being able to go to school and to function in school and focus on your classes and interact with peers, or whether it's your ability to get a good night's rest or feel good during the day and be happy and have appetite and things like that. Sometimes it's getting in the way of family interactions, causing a lot of stress and burden for the family. And so when those things start piling up and are persisting over some significant amount of time, well, that's when we'd probably start thinking about, does this child have an anxiety disorder?
Mm-hmm. Yeah, that's a great explanation. So it's about it. Anxiety is normal, but then when it happens, when maybe it is a false alarm, let's say something is not really dangerous, and then it's disrupting their enjoyment of life or interrupting the family system, that's when we would say this is a childhood or adult anxiety disorder.
Right, exactly.
Yeah. Okay. So then we also talk about OCD, and I think there's a lot of misconception around what OCD is, because I think we've seen it, and so we say it's obsessively washing your hands is the only thing. But can you tell us what OCD is and how we would know if our child had that?
Sure. So OCD actually is a condition that is a quite common. It's not a very rare condition, but it can present in a tremendous variety of forms. So sure, a lot of us will think about that kid who won't stop washing their hands all the time. And that is one form of OCD, but it's one of many. It ranges widely both in presentation, so what it looks like, and also in severity, because you could have some fairly mild OCD. You can also have really debilitating and very severe OCD. So what is OCD? Well, it really is some combination of obsessions. That's the O of OCD, is the obsessions. And those are intrusive thoughts, intrusive feelings, sensations, even images, things that are coming into your mind unbidden. You don't want to be thinking about it, but you can't stop thinking about it. And so it might be thoughts about cleanliness, but it can also be thoughts about harm, for example, the idea that I will or have harmed somebody in some way. It can be doubt. For example, did I really do that thing? I know I did, but maybe I didn't, and I can't stop thinking that what if, maybe I didn't do it. Sometimes there are obsessions around like order and symmetry, things like that, are things like, really lined up just the right way. We can have religious obsessions. Have I offended God in some way or done something morally wrong? Sexual obsessions are very common, even in children and even in prepubertal children. So it's not only adults or really mature adolescents who have sexual obsessions. And when I say sexual obsessions, I'm not talking about pleasurable sexual thoughts that, obviously we do have. But I mean, again, these thoughts that are coming that you don't want to have, that make you feel bad, guilty, gross, confused, things like that. And they're like coming into your mind, you don't want to have them. That's the O of the OCD. The C of the OCD, the compulsions, these are rituals, rules, rigid behavioral patterns that you have to comply with and abide by. Like you have to do this specific thing. So again, sometimes that might be a cleanliness ritual. I have to wash my hands, but it can also be other obsessions. I have to do things a certain number of times. Like this is a good number, that's a bad number. It can be evening out rituals. Like I touch this with my right hand, I have to touch it with my left hand. It can be checking, right? Like I'm just repeatedly checking things. Compulsive confessions. Like I have to tell you about something or something like that. It can be mental compulsions, the things that I'm not even doing really with my body, but just in my mind, counting or repeating a phrase, all different kinds of, those are, even those which were a lot, is really just a sample of the kinds of obsessions and compulsions that that kids will have. And one thing that is kind of interesting is that sometimes there seems to be this sort of logical connection between the obsession and the compulsion. So for example, maybe I do have a contamination, like germ-focused obsession, and then I wash my hands and it kind of seems to make sense. But other times, there really isn't that connection, right? Like maybe I have an obsessive thought about my mom having a car accident, and I still have to do the compulsion of washing my hands. And you might say, well, how does that line up? It doesn't, but doing that still helps me to feel better and kind of get rid of that thought or feel less worried about it. And so I have to do the compulsion. And most kids with OCD have some level of what we would call insight, meaning they realize that this is not really rational, that it doesn't really make sense. But realizing it's not rational doesn't mean you don't have to do it. It just means you're frustrated about the fact that you do have to do it, but you still have to do it. And so, sometimes getting a child to admit that the thing doesn't make sense really is not the same as meaning that now they can just stop it, which is really frustrating for parents a lot of times. Because it's like, well, you yourself say it doesn't make sense. So why are you doing it? But that's not how our brains work. We still feel very much compelled by it.
Yeah. So, and with OCD, it has to take up a certain amount of time. It can't be just like a thought you had once and then it goes away, right? It has to be some type of repetition where it sticks with you. Is that?
Yeah, that's right. And it's actually really important because if you were to just survey normal, healthy people and ask, do you ever have an obsessive thought or do you ever have a compulsive behavior? Actually, a big majority of them would say yes.
Yeah.
And some of them would say no, but it's not true. And others maybe really don't have that. But actually, most people do have some obsessive thoughts and compulsive behavior. So you don't diagnose everybody with OCD because of that. So like you said, we'll start thinking of it as a disorder when, A, it is taking up some significant amount of time. Maybe you're spending an hour a day doing it or even more than that. And it's really taking up a chunk of your time and also of your mental energy. And B, when it's getting in the way of other things, right? So, if you just live your life normally, but you have some compulsive behaviors, you might want to get rid of that. And that could still be a valuable goal for you, but we probably wouldn't call it a disorder unless it's interfering with your function or just like causing some really meaningful level of distress for you.
Yeah. So is OCD, do you think that's something that people can resolve, like a parent and child could resolve by themselves? Or do you think that's something that you would need therapy or some type of support to help manage that?
In a lot of cases, getting help, some kind of more focused professional help is actually going to be necessary. There are times when the OCD is maybe just really kind of starting or it's really mild, and just having some good advice, maybe getting like a book that you and your child can read through together or some exercises you can do, getting some good information can really be enough. But I think in most cases, if your child has pretty significant OCD and it really maybe has been around for a while or really is interfering in a truly meaningful way, then a little bit more concerted effort of working on it is probably going to be more effective than just trying to work through it on your own.
Sure, absolutely. Okay, so what advice do you have for parents with kids who have anxiety, what things can help kids with anxiety?
Well, I think a really important thing for parents to kind of realize, and that is sometimes a little bit counterintuitive, is that the biggest driver of impairment and the real difficulties in anxiety is not really that you have more anxiety than somebody else, although obviously that's a big part of it. But what really gets in the way and what really causes the big problems is when a child thinks, I shouldn't be anxious, it's not okay to be anxious, or I can't handle being anxious. Because if you feel like you can't handle it, then you're going to start putting a lot of energy toward not being anxious, right? Like you're going to start doing whatever you can to not be in situations where you might be anxious. And that's going to cause a lot of avoidance. And ultimately, it tends to perpetuate the anxiety rather than reducing it, right? Like just imagine two kids two friends, they're walking home from school, and they walk by somebody's yard, and let's say there's a big scary dog there, and it suddenly barks really loud, and it's running at the fence, and they're both really startled in that moment, totally normal. And they might have the same level of reaction in that moment. But if one of those boys walks away from that and, thinks, well, that was kind of scary, but okay, we're fine. And the other one thinks, wow, that was horrible, and I never want to feel that way again. Well, that's the kid who is not going to walk down that street tomorrow. And the next day, maybe doesn't really want to leave the house at all, because what if there is a dog? And a month later, doesn't want to watch a movie, because what if there's a dog in it? Because all these things could lead to those strong sensations of anxiety, which they're really feeling determined to avoid. And so you can see how that determination not to be anxious can actually drive so much of the impairment, which means that for parents, a really big objective can actually be teaching your child and showing them that it is okay to be anxious some of the time, that anxiety can be unpleasant and uncomfortable, but it passes. It's not really dangerous. I would say if you're a parent, don't be freaked out by the fact that your child is anxious. If you're freaked out, well, that's going to make them feel more freaked out about it as well. Kind of like if you were on an airplane and it's bumping around, there's a lot of turbulence, you're feeling a little bit nervous. Well, I don't think you want to look at the flight attendant and see them looking freaked out. Right? Nobody wants to see that in that moment. You want to look at them and see that they seem fine and they're calm and they're giving out drinks or something like that. And then you say to yourself, well, I guess we're okay. And so as a parent, you kind of want to show your child that it is okay to be anxious some of the time, that it passes. Even really big panic attacks, right? Panic attacks are really dramatic moments, because it's when like a wire trips in your brain and you just find yourself awash in these tremendous waves of anxiety. They crash over you with really intense physical arousal, with really scary thoughts. And it can seem incredibly scary, and it can also look dangerous. But even those moments, they're actually not particularly dangerous for your child. I like to say to parents, if your kid can run a quick sprint and they can be fine after that, they can probably have a panic attack and be fine after it as well. Because honestly, your body is kind of doing similar things in both of those moments, right? Like your heart's racing in both, you feel kind of queasy and nauseous, you're out of breath. Of course, if you ran a quick sprint, you're not worried about those reactions because you know why they happened, right? Like, of course, I ran, now my body feels like this. When it happens because of anxiety, when it happens out of the blue, especially without like a clear reason, well, that seems much scarier, but it's not really any more dangerous. And so even in those moments, and just in general, showing your child that anxiety is uncomfortable, but it passes and it's okay, is probably a lot more helpful than getting into a mode of, well, how do I make sure my child is never going to be anxious, right? Like, don't think about it like an allergy, right? If your child's allergic to peanuts, you probably do put some effort toward making sure that they don't have peanuts, because you know it's a true danger to them, right? And so you go to the restaurant and you're talking to the waiter, are there any peanuts in here? And you check all the labels and doing all this stuff to make sure they never encounter it. Anxiety is not an allergy. You can be really anxious. That's not anaphylactic shock. You're still going to be okay after it. You're not going to die. And it's not going to cause post-traumatic stress disorder, which is a very real thing. Not to, I don't want to confuse anybody. PTSD is a huge problem. It's a really true thing. But it doesn't happen from just normal anxiety responses, right? It happens from some, really significant, unusual moments in a child's life. So, I would say probably a really important message is remember that your kid's anxiety is not a peanut allergy, and they can be exposed to it and then still be okay.
Yeah. So let's talk about how can we normalize this? So let's say I don't have a kid that has any type of clinical anxiety. They're just the average kid, right? Anxiety when something scary happens or whatever. How can I introduce this idea as a parent to just normalize anxiety being okay?
Yeah, first of all, I think that's a really terrific question, because as a society, we should probably be doing a lot more to normalize mental health issues and just kind of learning about, even if you're never going to have like a psychopathology or a real disorder, to just be a lot more familiar and comfortable talking about how our brains and our psychology kind of works in the same way that we're comfortable talking about physical issues, right? Like nobody tiptoes around the fact, or most people don't tiptoe around the fact that people get sick sometimes, or some people have diseases sometimes, right? Like we're okay talking about that. And I think it's probably, it would probably be a really good thing if we were more comfortable talking about some other more mental health related issues as well. So how can we do that? Well, I would say a few things. One is start with yourself. In other words, can you talk about your own emotions, right? When you are having dinner, or you're just sitting around, or you're talking about your day, if you work really hard to never show any vulnerability, right? If everything always has to be perfect and you always cope with everything just fine and you're never anxious or you're never sad, well, then you are, you know, maybe you seem kind of really strong and brave and, you know, like competent to your child. But on the other hand, you're also teaching them not to talk about those feelings. And so I would say let yourself be a little bit more vulnerable. Another thing that I would say is like just be curious about your child's emotions, right? Don't be alarmed by them, right? Like sometimes your child is sad or they are anxious and we rush so quickly to it's okay, right? Like you're fine. Don't feel that way. And you think you're being really helpful, but again, you're probably also giving a message that says those feelings are bad. We don't want to feel that way. We don't want to talk about those things. And so take an interest. Teach your child to name their emotions, right? Not everybody's really good at that, but give them a vocabulary for talking about how they feel, what is sad and happy and cheerful and curious and anxious, and right, like just use these words so that they get good at naming their own internal experience. Because being able to name what you're feeling inside is actually a really good way to also start regulating how you feel inside. And I would also take it to a broader level, even beyond the family. Schools, for example. I think pretty much every school in the country, especially grade schools for younger kids, has some kind of physical education as part of their curriculum, right? Like nobody thinks that that's an extra or a bonus, or we'll do it this year, but not next year. Like everybody does that. And I think we should probably be doing something similar for mental education, just like we do physical education. Like, why not have that be part of how we're educating children and how we're talking about it? And other contexts too, right? You know, kids go to the doctor every year for a physical checkup, right? Like we call it a physical. Well, maybe we shouldn't call it a physical. Maybe we should just call it a checkup. And when you go to the doctor, maybe that doctor could be asking you a few questions that don't relate only to your height and weight and listening to your heart, but what about listening to your mind as well, right? It doesn't require a stethoscope. It just requires a few questions to children, to parents, right? Like, what are some of the challenges that they're seeing, and what is the child's mood like? Most primary care actually does not do that as any kind of screening, which is really important, because it again promotes this idea that physical education is okay and important, but mental education is like not as important and also maybe not as okay to talk about. And B, it's also really important because we're missing a lot of kids. You know, this is a little dismal of a statistic, but it's a reality that most children, from the amount of time that passes from when they have an onset of a psychological or psychiatric disorder until they are first detected. I'm not even talking about treatment. I just mean first, it like being recognized by anybody. Well, that time is measured in years, not in days, not in weeks, not in months, but in years, which is really a little tragic. It means that so much impairment is accumulating, so many problems are really kind of becoming so entrenched. There's such a missed opportunity there. And it also makes it harder to treat, because if you catch these things earlier, just like many other problems, they're easier to treat. And when you only get to it years later, well, that's been years of practicing feeling this way, and sometimes developing some really unhealthy coping mechanisms rather than being taught maybe some much more productive ones.
Yeah. Well, and I think what you're saying really resonates with me. I love the idea. I teach all the families that I work with to talk about feelings first. And sometimes they're like, well, I think my kid does okay with this. I'm like, well, how do you do as a parent with this? And they're like, right. So it's like, everybody has to be on board with this. But I think one of the things that I have noticed in the research on suicidal ideation or suicide attempts in adolescence is this idea of loneliness or feeling away from their peers, and whether that's physically, because there's a lot of things that keep us physically away, but also emotionally away, that we're not able to articulate what we're going through, to put words to it, to our parents, to our teachers, right? And so we're just sitting in it, and we don't realize that there is a solution. There's something that we could do that could help us to feel better. And the more that we practice something that's a solution versus practicing whatever maybe unhealthy coping skills we've come up with, is going to help us to feel better faster. But if our families aren't talking about it, then we maybe don't know that there is a solution. We're like, this is just where we are. I just have to deal with this. This is just the hand I've been dealt, or everybody in my family is anxious. So this is just the way it's going to be, but it actually doesn't have to be that way.
Yeah, no, that's exactly right. And it's really poignant and on point in terms of the suicidal ideation. Many parents, and not just parents, but even doctors and other providers, they're often really nervous to even ask about suicidal ideation. And we know that suicidal ideation is actually really common, and in most cases is not going to predict suicide. But when you don't ask about it, you actually make that risk greater. And some people think, well, I'm going to put this thought in my child's head. I don't want them to even know that suicide is a thing. Well, guess what? They do know that suicide is a thing. And if the only information, and think about it like this, if the only opportunities that they have to either learn about it or talk about it are with people who are not responsible for them, are with people who don't have a lot of information, with people who don't love them often, well, that means that they're having those conversations in the worst places rather than the best places, right? If the only place that they can ever share this is Instagram or online, or with sometimes really problematic contexts, well, that means that we're almost pushing them into the unhealthy direction rather than the healthy one. You're not going to cause your child to be suicidal by asking them about suicidality. And that sense of isolation is actually a big driver of suicidal behaviors. A dad said to me, it's kind of sad, but or really sad. A dad said to me not long ago that his daughter said to him, if I died, nobody would notice. And that thought, right, that idea can actually drive these kind of suicidal behaviors, in part because I feel so sad and alone, and sometimes also in part because I have a little bit of a fantasy that, well, maybe it's not true. Maybe if I really died, then they would sit up and notice. But we don't need to get to that point, right? We can show a child that we do care by taking an interest, by talking to them, by teaching healthier skills, by getting them support. And it's true in anxiety also. If we ignore it, and anxiety, it does have the potential to fly under the radar to a greater extent than some other problems that kids have, right? Like if you have really bad ADHD, well, that's probably going to call some attention to itself, at least in many cases, because you're distracted and it's impacting your grades, and maybe you're also being a little bit disruptive for other people, and so your teacher is kind of annoyed, and that annoyance isn't great, but it does mean that it's getting some attention. But you could have anxiety for a really long time and nobody really notices because you're just sitting there with it, and maybe you're not doing great in school, but you're not bothering anybody else. And so being proactive and having these conversations, I think that's really, really important.
Yeah. Well, and I'd also echo that if your kid identifies that they have anxiety or they're feeling lonely and you don't know what to do about that, that's okay. You can say, let's get help together. Let's figure this out, right? As a parent, we don't have to know all the things. It's okay. And I, as a therapist, don't know all the things. There are things where I'm like, okay, I got to ask somebody else about this, or I need to research this or figure it out. Let's do it together. Let's find out more about this. So I would just emphasize to parents that, like, you don't have to have all the answers, but noticing that something is disrupting your kid's life or impacting their ability to find happiness or calm or whatever that feeling is that they want, joy, that we can help them solve that. And by them putting words to it, I would rather my kids say to me, I'm so mad at you, or I'm really worried about this, or whatever it is, than just having a behavior or shutting down.
Yeah, no, that's exactly right. And I like your point about you don't have to be an expert in everything. I think that's true. And you're not, right? Like, none of us are experts in everything, but there are a lot of resources out there, and many really good places to get information. And when you do want to get information, maybe don't like just Google it randomly and go to every video. There's 10 billion videos on TikTok about mental health.
Sure.
And some of them have really good information, and many of them have really bad information, to be frank, because it's not being vetted by anybody, and it's just like put out there in the hopes of getting more views and more likes. But there are really reliable sources for information. If you're worried about anxiety, go to adaa.org. I'm not. No conflict of interest. It's just a plug for a really good resource where you can get information. That's the Anxiety and Depression Association of America's website. If you're worried about OCD, go to iocdf.org, which is the International OCD Foundation. These are really amazing websites. There are really good books out there. And there are also really good videos, but you just want to find ones that have been vetted for giving helpful, reliable, and evidence-based information rather than for maximizing likes.
Yes. Yeah, totally agree. Okay, with that, let's talk about the SPACE program. This is the model that you have created. Can you tell us about it?
Sure. Yeah, absolutely. So SPACE stands for Supportive Parenting for Anxious Childhood Emotions. And that's a mouthful, so I usually just say SPACE. But what it really is a completely parent-based approach to treating child anxiety, child and adolescent. I'm including, you could just say youth, but anxiety, OCD, and increasingly also some additional problem areas like restricted eating and chronic physical symptoms, but mostly focused on anxiety and OCD. And when I say that it is completely parent-based, I actually mean two things by that. One is that it's the parents who go to treatment sessions and not the child. That's the more obvious thing when we say parent-based. So the kid actually doesn't have to go to treatment at all. And in fact, they really don't even have to want treatment, which is kind of important because not every child who has a disorder necessarily is asking for therapy. It's not the same thing. And so they really don't have to have any motivation or go to sessions. You don't have to drag them to the doctor or anything like that. So it's parent-based in that sense. But the other sense in which it's also parent-based is that SPACE really focuses entirely on changing the behavior of the parent, not on getting the parent to change the behavior of the child. Like you said before, a lot of work with parents is you're going to go home and you're going to get your child to do X, Y, or Z. Maybe that's an exposure or a breathing exercise. And those things are really good and they work great, assuming you have a kid who wants to do an exposure or wants to practice a breathing exercise. If you're a therapist and you're trying to do exposures with your patient and they don't want to do it, you probably don't yell at them. Right? I don't know a lot of therapists who start yelling at their patients or telling them they're no good or taking away their television. But when you're a parent and your child doesn't want to do the thing that is so important, sometimes you do fall back on some really unhelpful scripts that maybe you've learned in other contexts for how do I handle it when my kid doesn't want to do stuff. And that can actually create a problem. In SPACE, the whole focus throughout the whole treatment is just on changing your behavior as the parent. I'll say to parents, like session 1, I'll usually say, let me give you a simple promise. In this treatment, A to Z, the whole time, I'm never going to ask you to make your kid do anything at all, or to stop them from doing anything at all, because we know how hard that is. And there are really 2 kinds of changes that space tries to bring about in the way in which parents are responding to their child's symptoms. One change is we want parents to be more supportive of the child. We'll train them on what is a supportive response. A supportive response in space is anytime you're able to show your child both an acceptance of the fact that their distress is real, right? You're acknowledging it, you're not dismissing it, you're not denying it, it's real. That's how they feel, whether you feel that way or not. That's how they feel. And so that's like the first part of the supportive message, is just like a validation of your child's distress. But it becomes supportive rather than just validating when you combine it with a message of confidence, meaning I'm also showing my child that I think that they actually can handle being a little bit anxious some of the time. I have confidence that they can handle that. They can get through it. Maybe it's hard, but they can get through it and still be okay in the end. It goes back to what I was saying earlier in our conversation about how important it is for kids to learn that it is okay, that they can handle anxiety. And so what does that sound like? It might sound like a parent saying to a child, I get it. This is really scary for you, and I know you can handle that feeling, for example. So that would be a supportive message because it has both of those ingredients. And, you know, I often say to parents, as a parent, you're a little bit like a mirror that your child is looking into to see who they are, right? They're learning about themselves by looking at you and how you respond to them. And if your responses to them are showing them that they're weak and vulnerable and helpless, well, they come to believe that. And that ends up leading to more anxiety. And so we want to show them this supportive message, right? You're giving them that acceptance, and you're also communicating confidence that they can handle being anxious. And so the support is the first of those 2 meaningful changes that we try to create in how parents are responding. The other one is to gradually reduce what is known as accommodation of the child's anxiety. What do I mean by accommodation? It's really just any way that you as a parent are changing your behavior in order to help your kid not be anxious, which is the most normal and natural thing in the world, but ends up being actually counterproductive. It ends up being unhelpful. What's an example? Maybe my child has separation anxiety. They're scared to be away from me, so I don't leave them alone. Or I sleep next to them at night, or I leave all the doors open so they can always see me. Maybe my child has social anxiety, and so they're uncomfortable when people talk to them. Well, so I talk instead of them. Or maybe I stop inviting people over to my house because it's going to make them feel shy and uncomfortable. Or we don't go to the family get-together because they always feel so awkward and socially anxious. And so these are examples of how parents could be accommodating their child's anxiety. We see it also in OCD. My child has OCD, and I never say the word that is like a bad word for them, or I never sit on their designated chair because I'm going to contaminate it, or I listen to all their confessions, or I do rituals with them, et cetera, et cetera. And so these accommodations, they're incredibly common. Almost all parents, this is like based on many, many studies all around the world, what we know is that almost all parents who have an anxious child will regularly accommodate that child's anxiety because it's kind of hardwired into us, right? Like children are just like programmed. When I'm anxious, I look to my parents for help, and parents are programmed. When my child is anxious, I step in to protect them, to soothe them, and make them feel better. So it's very normal. But what all of that research also shows is that accommodation tends to maintain anxiety and actually even sometimes lead to more anxiety over time rather than reduce it. And so the other thing we do in space alongside the supportive responses is to just systematically, not all at once, not overnight, but systematically identify what are the ways that I'm accommodating, and then gradually work on pulling back and reducing those accommodations, which, to nobody's surprise, is not always met with enthusiasm on the side of children, right? Like, kids don't always clap and congratulate you when you start reducing accommodation. And so we also have a whole set of tools in the treatment. How are you going to handle it if your child gets really mad, or they say you don't care about me, or you don't love me, or I can't live like this, or different kinds of challenges, maybe even aggressive, and we'll help parents to just systematically work through it. But multiple randomized controlled trials, which is like the gold standard of evidence in psychotherapy, but multiple randomized controlled trials now show that doing space, even without any child participation, is a really effective way of treating these problems. In fact, just as effective as doing therapy with a child directly. And so that's really what this treatment is and what it's about.
I love it. Yes. And I got trained in this. And so I love this program, and I've been using it with parents, and I think it's incredibly effective. Is it indicated? Can kids also go to some type of like cognitive behavioral therapy in conjunction if they are willing?
Absolutely. Absolutely. You don't necessarily need to choose between, one thing or the other thing, right?
Mm-hmm.
Like, if you have, I don't know, if you have ache, you could both do a massage and also take ibuprofen, right? And
Sure.
like, maybe they'll both work together, and it'll be even better than doing either one alone.
Mm-hmm.
And that is true here. Also, you can do space alongside doing cognitive behavioral therapy or another therapy directly with the child. Sometimes you want to start one first and then introduce the other.
Mm-hmm.
Other times you might want to really just go for it and do both things at the same time.
Yeah.
And I think that's probably the ideal scenario. Obviously, doing two things is always more resource constrained or
Sure.
costly than doing one thing. And not every, access to care is a burden, not a burden, it's a challenge and a barrier for a lot of families. So not everybody's going to be able to do both, but if you can, I think that's probably ideal.
Yeah. Is there anybody that space is not made for? Anybody that you're like, this is not the right population or parent to use space?
Well, we mentioned PTSD before, and we don't really have data on, is space an effective treatment for actual post-traumatic stress disorder? And so I would probably be much more cautious about recommending it for that, especially as a standalone treatment without other treatment components. And then, sometimes parents have their own psychopathology, their own difficulties, and that's okay. You can do space as a parent, even if you're anxious yourself, or even if you're a little bit depressed yourself. But I think when you are struggling very deeply and really are in crisis yourself as a parent, then it might make sense to let your child be in therapy for right now and maybe get a little bit of help for yourself, and then maybe do the space after you're feeling a little bit better yourself. Because if you're already feeling underwater, then adding even more to your plate can be sometimes just a little bit too much.
Yeah, absolutely. Yeah, we have to be kind of ready for it, even though it's mostly in space, us as parents participating in the program, to the benefit of our kids, even though they may not feel that way always about the program. But I have had families have really great success, and I know you have too. What do you want parents to take away from this conversation that have anxious kids?
Well, I think there's two messages that I would want parents to have. One of them is, this is not your fault. And that's really important to me to emphasize, especially because I am talking about how parents can maintain sometimes anxiety through their accommodations, or how they can be the focus of treatment. But I really want to make clear to anybody who's listening to this that that is not the same thing as saying that your child has anxiety because of you. I really don't think that parents are the cause of kids' anxiety disorders. I mean, putting aside the worst of parenting, right? If you're abusive and neglectful, then sure, that might be really harmful. But if you're listening to this podcast, you're probably not listening because you're an abusive parent who wants to find better ways to abuse their kids, right? Like, I think that's probably not the case. And for the huge majority of children who have an anxiety disorder, it's really not because of what you did as a parent. Even the accommodation, I do stand behind what I said, because that's what the data indicate, that accommodation can maintain anxiety. But you have to remember that you're only accommodating because your kid was anxious in the first place, right? Like, you didn't start the cycle, you're responding to something in the child. And I know we like to, in like society today and culture, likes to really talk about all the, like, you're a helicopter, you're a lawnmower, like all these different kinds of parenting styles and how you should parent kids. Personally, I think there are lots of good ways to parent children. There's not one way. Our species did not evolve to this point by all parents doing exactly the same thing, and that's totally fine. So I would say a message here is, yeah, you can be the solution to this problem. That does not mean that you caused the problem in the first place. Just like when your kid gets sick, you don't have to have made them sick to just be a caring parent who wants to help them to get better, right? So don't confuse those two things. And I think the other message I would want to leave parents with is a message of hope, which is to just remember that the world is chock full of kids who used to have an anxiety disorder or used to have OCD. These are common problems and they are severe in many cases, but they are also treatable. It is possible to overcome even severe anxiety or OCD. And so, sometimes it's easy to get very discouraged and to feel like, this is just so deeply ingrained and it's never going to change. But the reality is that there really are no more treatable problems than the anxiety problems. And so take a breath and, it's worth getting that help and working on it, because there's actually a really good chance that you can give your child a much better life and a much better existence, even if right now things seem really hard.
Yeah. Thank you so much for this conversation. It's been so helpful, and you've described so many things so well and easy to understand, but also just this message of hope.
Yeah, well, thanks for having me on. Anybody who wants to learn more about SPACE can go to the website, which is spacetreatment.net. You can even find there a book for parents called Breaking Free of Child Anxiety and OCD, that you can kind of learn a lot about how to do this stuff with your child. And thanks for having me on. Thanks for listening to whoever out there is listening to us.
Thanks again, Dr. Lebowitz. That was all really great information. I am so thankful for the SPACE program, because I know that it is making a difference in the families that I work with, but also through the research that they've done to support that this program is really helpful for everyone that has a child with anxiety or OCD. Thank you for all the work that you've done, Dr. Lebowitz, with this. Thank you for taking the time to share with us this message of hope, and also further our understanding around how we can raise kids that are free from disordered anxiety. With that, I'll say thank you so much for your time today. Please like, rate, and subscribe to our show. Follow us on Facebook, Instagram, TikTok, and YouTube. And also keep the emails coming to accidentalexperts@gmail.com if you have a future topic for us to discuss on our show. With that, I'll say have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.